mad dogs really go out in the sun? I ask this because our resident canine has refused to go out this summer at all. And this dog is really quite mad. I mean, you have to be all kinds of crazy to jump into a moving cement mixer. But this year in the summer, he just decided, I'm going to stay on this woman's doorstep and I'm not going to go out. And this made me really wonder, has Delhi finally become so hot that even mad dogs refuse to go out? This summer was so strange, and it wasn't just the animals on the road that were affected. It was the human beings indoors as well. Everybody around me was on edge. They were temperamental. It would take just the barest whisper of a suggestion that one would have to step outside for 5 seconds for them to lose their temper. And there was a significant amount of lethargy as well. And it was the first year I realized how sly heat is when it comes to sapping your energy. You go out and you think all you're going to be is hot, and you're fine till you come back indoors, and suddenly you realize you're exhausted. A book I've been reading recently, it's called Mem Sahib's British Woman in Colonial India. And it actually reinforced the same thing, that when you are exposed to an unusual amount of heat, it does affect your energy levels, it affects your mood, and it affects your health. Thankfully, today we have air conditioning and fridges that can make ice in 2 minutes flat, unlike the poor British memsahibs who had to make do with khaskhas and dunking their heads in cold water in the middle of the night. But is what we have today, is that enough to keep us safe and protect our health? Or are we getting sicker with every passing heat wave without even realizing it? This is Sonali Acharji, and you are listening to Health Wealth, a podcast that wants to help you understand that good health doesn't have to come at a cost to your mental peace and the occasional chocolate biscuit. If you currently don't suffer from any chronic disease or condition, then we have done previous episodes looking at summer well-being and health. But for this present episode, I thought let's focus on what heat does to those who are already diagnosed and going through treatment for a chronic disease. There is medical research done which shows that heat will make a cancer patient more tired. It will dehydrate a diabetic quicker. It will cause skin problems like acne or rashes. And I recently read a very interesting study that was published last month in a journal called the Annals of Internal Medicine. And it looked at 60 people with coronary heart disease, and it found that, yes, those who are older and significantly, suffering from a more chronic version of the heart disease, they did have blood flow blockages when it was hot. But what I found very interesting is even those who were younger with a milder or a recently diagnosed heart condition, even those people at very mild higher temperatures, their hearts were beating faster and they were working harder and they had some measure of oxygen debt. Now, we can't cover every single chronic disease and its relationship with the heat, but we can use this episode to cover a very important and rapidly rising one, hypertension or high blood pressure. It has become almost impossible to go out for a group lunch and not have someone at the table say, I can't eat this, too much salt, I have high BP. But is that a bad thing? Surely we have enough medicine available today to manage blood pressure. So why should we be concerned and religiously be reading salt levels on everything we consume? And if medicine is already controlling our blood pressure, then what harm can a heat wave possibly do to us? We are joined today by Dr. Dorairaj Prabhakaran, who is a cardiologist and an epidemiologist. He is also the executive director at the Center for Chronic Disease Control. He is here to help us understand the science of blood pressure, how to look after it, and for those of us who have hypertension, the most reasonable and effective way to stay healthy during a heat wave. Hello, sir.
Hello, Sonali.
How are you?
I'm very good. Thank you for having me here.
Thank you so much for coming to discuss a very, very important condition that everybody talks about these days. But before we get there, you work with the Center for Chronic Disease Control, and I didn't even know this exists. So, can you maybe tell us a little bit about what CCDC does?
Yeah, CCDC or Center for Chronic Disease Control has been in existence for almost 24 years. It started in 2000, but became very active over the last 8 or 9 years. The stated aim, I mean, the ultimate aim of CCDC is to connect science to policy, generate the evidence, connect them to policy, and scale up all the evidences that are available. So CCDC works in the area of chronic disease, but does three things. It tries to understand the mechanism of high propensity to chronic disease amongst Indians. For example, we know that we are at a very high risk for heart attacks as compared to the Western population. Why is this? Is one of the areas of research that we do. The second is we try and identify low-cost solutions using digital health, task shifting, and several other mechanisms, improving quality of care across several chronic diseases. The last is we try and build capacity in evidence-based management of chronic diseases amongst primary care physicians, as well as build research capacity. These are the three things that we do.
Mhm. And you've been recently doing a lot of work around raising awareness on high blood pressure. Why is this a disease that you've chosen to focus on, and how bad is it in India right now?
So it's not a cliche if I say hypertension is a silent killer, because not many people have any symptoms with hypertension. Hypertension, or high blood pressure as it's known, is doesn't cause symptoms in most people. Maybe 10-20% of the people may have headache or giddiness, or it comes to the fore when they go to the hospital for some other reason. Normally, it's detected routinely when people measure the blood pressure and you find that your blood pressure levels are high. You asked me a question, how bad is it? If you look at adults above the age of 20 years and say what proportion of people have hypertension, in the urban areas, I would put it around 35 to 40%. And in rural areas, around 20 to 30%. Overall, the estimated figure is that 30% of Indians, adult Indians, have hypertension. So that's a staggering number. If you put it in actual numbers, it goes to almost 250 million or so.
Right.
So 25 crore people having hypertension.
Yeah. And, I always believe that a lot of us, we hear these diseases and these names, but we don't understand the fundamentals of it because, we've not really studied medicine, and people like me dropped biology very early. So maybe we can just start with the very basics. What is blood pressure?
So before understanding what is blood pressure, why should blood traverse throughout the body? So blood
Mhm.
is transported across the body. Fresh blood is transported across the body through tubes called arteries. And then there is an exchange. It gives out oxygen and then comes as impure blood as veins, through the veins, into the heart. I mean, into the lungs, where it gets oxygenated, goes into the heart, and the heart pumps blood into various parts of the body. Blood pressure simply is the pressure exerted by the flowing blood on the walls of the tube.
Mhm.
So, I mean, in medical terminology, we call as lateral pressure exerted by the blood on the arteries. But in simple terminology, these tubes are elastic. They're not, you know, rigid tubes. They're elastic. They can expand. They can relax. The pressure exerted by the blood, flowing blood on the arteries, is called blood pressure. And you
Mhm.
require a certain amount of blood pressure for the forward flow of blood to the peripheries, to various parts of the body. And that's
Right.
why the blood pressure.
And why would that increase or decrease? Why can't it just stay, at one level?
It cannot stay at one level because your blood pressure has to go up when you exercise, for example.
Mm.
When you run, for example, when you're frightened because of something. I mean, you watch a movie and a horror movie and you get frightened. So, for all these reasons, because this is what we call as a flight and fright mechanism, because
Right.
human beings were hunter-gatherers.
Mm-hmm.
We're not agriculturists when we started out. So we had to be constantly on the vigil for some animal coming
Mm-hmm.
and attacking you
Yeah.
or something happening. So you had this mechanism in which your blood pressure had to go up suddenly so that various parts of the body gets adequate amount of oxygen and energy to, do that activity. Now we are in a more stable state. So sometimes what happens is, in some people, this heightened state of anxiety, and not, I won't call it anxiety, heightened state of sympathetic activity, which increases the
Mm-hmm.
blood, is present. So we cater to it by various mechanisms. But major role now in terms of increasing blood pressure is on the diet. There
Mm-hmm.
are two things that increase or decrease the blood pressure. One is salt. High salt consumption increases blood pressure. So one might say that, as we grow older, blood pressure naturally has to increase. It need not necessarily happen. If, for example, we don't give our kids any salt and bring them up without salt so that they don't feel the need for salt at all. This
Mm-hmm.
happens in some sub-Saharan African population who are not, who never use salt. Their blood
Mm-hmm.
pressure goes up. So our blood pressure goes up, one, because of salt consumption.
Mm-hmm.
Second, inadequate consumption of fruits and vegetables. Third, high alcohol consumption.
Mm-hmm.
Fourth, low physical activity. Fifth, of course, is stress, which is very nebulous and difficult to measure, but
Yeah.
stress is also touted as a cause. And there are other things now which are emerging, such as air pollution, for example, that also increases. We have shown that increases blood pressure. And some people have genetic causes, but that's a very small proportion, 5 to 10%
Mm-hmm.
of the
Yeah.
population. So these are
You
the
know, when one is lying on their sofa and watching OTT and eating peri peri fries, you tend to forget that your body wasn't designed to do this.
exactly.
And you're so comfortable, and the body also craves that level of comfort. I have to remind myself that if I, don't reverse or don't do something else, then I'm going to get, some sort of chronic disease, including hypertension, and it will make me ill. So perhaps you could maybe explain what is the impact of hypertension? You said it's a silent killer. How
Yeah.
bad does it get?
So the major cause of strokes,
Mm,
strokes are considered worse than death, because if you see a person with stroke, they find it extremely difficult to get
mhm,
it taking care of themselves. They require support. They're unable to walk. Some of them are unable to talk. So it's a long process, and many people may not even recover. So hypertension is the major reason for stroke, because as the blood pressure, it's like, a balloon, for example. You keep on putting some water, the pressure increases inside. Suddenly there comes a stage when it bursts.
yeah,
Similarly, the blood vessels in the brain burst and cause hemorrhage. So hypertension is one of the most important cause for hemorrhagic stroke. Second is, because the blood pressure is high, it damages the interior of the arteries or the tubes which carry the blood. And if it damages the artery which supplies blood to the heart, then it can lead to a heart attack through not immediately, but over a long period of time. And
mhm,
then it can also damage the artery that supplies the brain, and that also can result in stroke. The
right.
third is, the heart exerts a lot of effort in pumping out blood. So if the pressure at distal end, I mean, if you're pumping blood into a vessel which is very hard to,
Mhm,
which is very hard and doesn't relax, the heart has to exert a lot. Because it exerts so much, there comes a time when it starts failing. We call that heart failure. Then the other thing is, the kidney vessels, the blood vessels in the kidneys are damaged, so there's
mhm,
kidney failure. So hypertension causes actually four problems. One, it causes stroke. Second, it causes coronary artery disease or heart attack. Third, it causes heart failure. And fourth, it causes kidney damage. So these are
yeah,
the things it
yeah.
causes.
And you mentioned, the silent part of it, that it doesn't have many symptoms. But are there some serious signs that one should keep in mind? And with all the advancements in diagnostics today, I recently went somewhere, I had to stick my finger in and they could tell my blood pressure. So for us, what are reliable diagnostic tools? And should we be, monitoring it more regularly at home?
So you don't have to monitor it regularly. You should get your blood pressure checked at least once.
Mm-hmm.
Once you become an adult, you get your blood pressure checked once. If it is normal, you can check it once a year. Some people say that you can check it once in 5 years, but I would say, given that it's such a simple thing to measure, one annual check in your blood pressure, if it is normal, should be fine. If it is
Mm-hmm.
abnormal, obviously you try. what are called as lifestyle measure in terms of exercise and
Mhm.
decreasing your salt intake. And that's very simple, actually, decreasing salt intake. It's not that you have to completely stop using. You can stop taking pickles, for example, which are
Yeah.
very high in salt, poppers, which are very high in
Mm.
these chivdas, which you buy as a snack, very high in salt. Then you can also reduce your, because some of the fattening substances increase your body weight and increase your blood pressure. You can reduce that. So just be moderate, try and reduce these things. Eat more of fresh fruits and vegetables.
Mhm.
Fruits, especially that are, you might say fruits are very expensive. How can I eat fruits and vegetables? I'm not saying that you have to have a New Zealand or a Washington apple. You can
Mhm.
have locally available berry, which is very rich in
Mhm.
potassium, locally available guava, which is very high in potassium. So anything that is locally available and inexpensive, you can have that. So all of these things can actually reduce blood pressure. But I would bring back to one important point which I want to say is hypertension or high blood pressure is considered as a disease of three paradoxes. Very simple to diagnose, but the awareness level is extremely poor. Very simple to treat, but the treatment rates are abysmal. Many good drugs, simple drugs, inexpensive drugs are available, but the control rates are extremely low. So I think we need action in all these three areas. We need to increase
Yeah.
awareness of people, and we need to identify and treat people with blood pressure, and we need to treat them to targets. Get the blood
Mhm.
pressure lower than 140 by 90 or 130 by 80, depending on the condition of the person. So the most important thing, you ask me for symptoms, the most important thing is that you're not screened. You
Mm.
have to get screened sometime or the other. And symptoms happen only when the blood pressure levels are very high, or in certain forms of hypertension, which are called secondary hypertension, which happens in 10% of the people. There is a reason why the blood pressure has gone up. In those people, there may be some symptoms. Or if there is a complication because of hypertension, you may start having symptoms. You have a stroke, you may start off with a headache. You have breathlessness because your blood pressure goes up. So these are late stages. In the early
Mm.
stages, there are no symptoms, but it's very, very important to screen for hypertension.
Right. And you mentioned it's easy to treat. And I know BP medicine is something, at least in urban India, urban middle to upper class India, it's everybody who has hypertension takes these medicines. Um, can you talk a little bit more about these medicines, their impact on you? Because I know, for example, somebody on blood thinners, if they get a cut or if they fall down, they keep bleeding, and it's very, very difficult to stop it. So, can you maybe walk us through the medicine part of treating hypertension?
Actually, there are multiple drugs now to treat
Mm.
hypertension. One which relaxes the heart, one which blocks the calcium entry into the cells, because calcium is one of those things which increase the blood pressure. They're called calcium channel blockers. One which acts through what is called as renin-angiotensin system. One hormone called angiotensin increases the blood pressure. So there are drugs which causes blockage of the angiotensin production and decreases the blood pressure. There are multiple different drugs that are available.
Mhm.
But the most important part is these drugs have been in existence for almost 30 to 40 years, number one. Number two, most of them are off patent. Number three is they're extremely inexpensive. For example, if the government buys it in bulk, you can get as low as 50 paise per tablet. So it's as cheap as that. In fact, they are part of the essential drugs list by the Indian government. It is available. You mentioned urban areas, it's available in rural areas too, in many of the
Mhm.
primary healthcare centers. For example, in the whole of South, I have visited many of the primary
Mhm.
healthcare centers and they have these drugs. So it's
Mhm.
not that for want of drugs, but it's just that people, when they're identified, they might come for one or two visits and they forget about it. Then there's a misconception amongst
Mhm.
people that, my blood pressure is under control. Why should I take the medicine?
Yeah.
So the fact is hypertension cannot be treated. It can be controlled. Once you stop taking the medicines, your blood pressure will go up. So you have to take it lifelong. But the question is, how do you adjust your blood pressure? One of the things that we do is in summers, you might have to reduce the blood pressure a little bit, because in the winters, blood pressure goes up. In summer, it comes down. I mean, you're asking about heat. We will talk about that a
Mhm.
little
Yeah.
bit.
Yeah.
That's an extreme example. But
Mhm.
garden summers, when the temperatures goes up, the blood pressure actually comes down.
Yeah. And so I'll give you an example. About 2 months ago, I was with a friend, and every 10 minutes, she was drinking a glass of water.
Mm.
And I found that very funny. So I said, what's going on? And she said, I was on TikTok and I saw this video which said that if I drink enough water, it'll thin my blood and my blood pressure will reduce. Um, and we had this whole like long conversation. I said, please talk to a cardiologist. I don't think this makes much sense to me. What are the dangers? So she did water, which I mean, at best, she'll be going to the toilet a lot. But there are a lot of dangerous recommendations out there for managing blood pressure. Um, what are the dangers of doing this for you as a cardiologist? You must be seeing patients who would be coming after they've done something wrong. How bad can it get?
See, the thing is, water you think is very safe.
Mm,
There are people who have had water toxicity, particularly the elderly.
mm,
So don't go by these WhatsApp messages. Verify it yourself, or best is to go to your doctor, not necessarily a cardiologist. It could be a primary care physician, it could be an internist, it could be anybody who understands the disease well, can explain to them. So water is one thing they say. Then other people will say warm water. Then some people will say that keeping some stone or tying a wristband. All of these,
mm,
none of these actually decrease your blood pressure. And there may be the people may say that there are herbal medicines. Now the thing is, we don't know the active principle in herbal medicines. They may be good, I don't know, but they haven't been evaluated, and some of them do cause liver damage and some other problems, and heavy metals may be there in some of these so-called herbal medicines, which can cause kidney damage. So
mm,
it's better that if you're doing lifestyle measures, perfect, no problem. You can do salt reduction. You can do yoga, which is very good in
mm,
controlling blood pressure. You can do leisure time physical activity. And if you're a sedentary person, you're always sitting, try and get up and walk every 30 minutes for 1 or 2 minutes. All these things can bring down blood pressure. And I'm all for lifestyle measures. But once you require drugs,
mm,
these drugs have been evaluated. I mean, uh, they have gone intensive evaluation over the last 50, 60 years. I will give you the example of President Roosevelt. At that time, the treatment of hypertension was considered masterly inactivity because people felt that, higher the blood pressure, it protects the brain. His cardiologist actually saw his blood pressure going up to 300 by 200 when he was dying. So that we have moved from that phase. But unfortunately, there are some people who still think that we should not do anything about hypertension. They say these drugs have side effects, this and that.
mm-hmm. Yeah.
All drugs have side effects. All allopathic drugs have some side effect or the other. But the
Mm-hmm.
beauty of antihypertensive is if one drug has a side effect, there's another one which might suit you. So
Mm-hmm.
try and choose the right drug. I mean, if you're put on amlodipine, you get a swelling of the legs, which is intolerable. We can
Mm-hmm.
stop and give you something else.
Yeah.
So there are many ways of handling that. Don't be frightened of the drugs. And second thing is, somebody might say, oh, this is a new drug, new kid on the block, let's try that. Don't try new drugs. I believe that you should wait for at least 5, 6 years after a new drug has come to know
Mm-hmm.
what true dimensions of the side effects of those drugs are.
Yeah.
Very well established, simple drugs are available, and you, in consultation with the doctor, you be a partner in your own healthcare and take those
Mm-hmm.
drugs. And please avoid looking at these WhatsApp health messages. Those are all bunkum and nonsense.
Yeah, yeah. And but they're so real. Sometimes it's very difficult to tell the difference between them. We'd originally started this by talking about heat and that it's getting so hot that I mean, even if you're insane, you really don't want to go out. Um, but for someone with hypertension, it's doubly difficult in the heat wave. So can you talk a little bit about how this increasing temperatures is affecting our blood pressure?
I said in summer the blood pressure decreases, but very high heat can actually paradoxically increase it. Second is it can increase your heart rate because there may be dehydration, for example.
Mhm,
Third, actually, you can have a precipitous fall in people with hypertension because they are taking drugs called diuretics.
mhm,
Diuretics increase your urine output and thereby decrease your blood pressure. But in extreme heat, they can be detrimental. So you need to be very careful if you have hypertension, you're taking drugs. Keep your fluid intake high. That's very important. Second is try avoiding going directly into extreme direct sunlight. I mean, short short stints you have to do if you're going out and getting out of your car or getting out of a bus and going into another area. But just be just keep on hydrating
Mm.
yourself, and every degree rise in temperature, what happens is when you get to very high levels of temperature like 50 degrees, 48 degrees, etc., your core body temperature also goes up.
Mhm.
So for every degree rise in temperature, every degree centigrade rise in temperature, you almost lose 1 liter of water. So I
You
cannot
have
give
to
you the
drink,
exact
yeah.
amount, but you have to hydrate. If
Hmm.
in 3 hours time you're outside most of the time in extreme heat, try and drink at least 1 to 1.5 liters of water. Better still, if you can carry some lime juice with salt and
Mm.
sugar in it, that will be very good for you.
Yeah. And, apart from hypertension, just chronic diseases, India has such a high burden of non-communicable diseases.
Hmm.
Can we go so far as to say that climate change is making chronic diseases worse?
It would, because climate change doesn't come with, it's not a simple thing. Climate change, what does it do? You have these extremes of temperature. You have extreme cold, which can cause a lot of problems. It can increase the risk for heart attack. It can worsen your heart failure. Extreme heat can cause strokes because it causes a clotting tendency in your blood.
Mm.
The third thing is extreme floods, for example. You might not get the kind of care that is required. You may not be able to reach the hospital.
Mm.
So it can cause multiple things. Then it's associated with air pollution.
Yeah.
So all these three or four things put together can worsen the chronic disease
Mm.
epidemic that we are facing.
Yeah. But how do we, I mean, you mentioned your first point was awareness, right? So it's not like anybody is a stranger today to the fact that, they're growing health problems. Every time you open Google, for example, you just keep getting these pop-ups that say, hypertension on the rise, obesity on the rise, so on and so forth. But how do we start making awareness or start building awareness that actually leads to action and that makes one realize just how dangerous a situation we are in with climate change and pollution?
So the thing is, let's flip the question around and see what can we do in terms of being healthy in the face of climate change and air pollution, right?
Mhm.
Rather than ask the question the other way around. So what we as individuals can do. One, irrespective of whether climate change and air pollution, they are real, they exist. It's in the domain of policy. But as individuals, what we can do is whatever small things that we can do in terms of keeping our environment safe, we should do. But in terms of health, for example, if you're healthy, there's no family history, nobody in the family has had any chronic disease. Once you're an adult, get screened for very few simple things. Get your body weight checked, get your waist circumference checked, get your blood sugar checked, get your blood pressure checked, and get your lipid profile, which that includes cholesterol and all that checked. So everything is fine. Come back after 5 years and get it checked if you're younger. As you grow older, beyond 40 years, you might do it once in 2 years. As you grow even older, at 50 years, you might do it once a year, right? So do that. And as soon as you identify a problem, uh, do the intervention that is required, either lifestyle. If you're overweight, try and lose weight. If your
Mhm.
waist circumference, try and reduce that abdominal fat by doing some specific exercises, or even dietary change can help. Rice eating, high carbohydrate content, even maida, for example, all of these have very high levels of carbohydrate. They can increase your abdominal fat. Try and
Yeah.
reduce them. So there's a concept called food exchange. Suppose you eat 3 katoris of rice.
Mm.
Why not eat 2 katoris of rice and 1 katori of vegetable? You will be satiated, but you'll also be feeling healthy.
Mhm.
So simple adjustments in your life style can help in combating these chronic disease. Then if you're a woman at 35, 40 years, you
Yeah.
should get your breast examined. You should
Mhm.
get pap smear done. right? And then if you're a smoker, stop smoking. If you use tobacco, chewing tobacco, stops chewing tobacco because
Mm.
it's associated with high proportion of oral cancers. So stop that. So there are these simple things. And then if you don't consume alcohol, don't start that habit. But if you're in the habit of taking alcohol, be a social drinker, take it occasionally, but at a given time, not more than 2 drinks.
Right.
So
And one can listen to educative podcasts.
yeah.
Thank you very much for everything you've shared. It's been very, very educative for me, certainly. Thank you.
Thank you very much.
I have a friend who was diagnosed with hypertension 2 months ago at the age of 38. And she went to Paris 2 weeks ago and she forgot to carry her BP medicine. She left it in India. So when she returned a week later from the city of love, she had a bloody eye because her blood pressure went up so high that a blood vessel in her eye actually burst. Another friend who does take BP medicine, he tends to forget it once in a while. And because of that, he has these frequent nosebleeds and these very erratic mood swings. Although the mood swings could also be due to reading too much Reddit. Anyhow, blood pressure, even when controlled, can do some amount of damage. So, why get here in the first place? If you aren't already hypertensive, why would you willingly condemn yourself to a life of remembering to take medicine and budgeting in medical bills? The human body is so incredibly powerful and beautiful in its workings. To ruin that fine balance of biochemistry that has taken evolution millions of years to create, it's such a pity. I consciously want to look after my blood pressure because it's not an invisible thing or a digit that's just there on my path lab report. Blood and how it flows inside of me is life. It's everything I am. No boss, no car, no date, no school, no celebrity crush will feel my pain when my life comes crashing down because of poor health. Taking care of ourselves shouldn't feel like a luxury or pressure. We need to embrace that instinct to heal ourselves, to be a partner in our own well being, not bury it away under the rule book of achievements and selflessness. Did my little health lecture bore you and inspire you to do something about your well being? And how did the last few months of intense summer heat impact your life? I'd love to know more about your thoughts. You can share them with us at pods@indiatoday.com or you can message us at 8588 966 996. And if you enjoyed this episode, please do rate us. We are there on Google, Spotify, Apple, and YouTube.